Okay, looks like the meeting recording has started. Is that correct, Bonnie?
That is correct.
Okay. I think we will just get started then. Good morning, everyone. Thank you very much. Thank you very much for being here at this Public Safety Communications Task Force Community Listening Session. It looks like maybe people are still popping in, so I just want to make an announcement as people are coming in, and that is that we have 2 American Sign Language interpreters with us today. You should see them on your screen spotlighted with the words ASL interpreter in their window. If you happen to be someone who needs that assistance, if you would like to, you can identify yourself in chat, and the interpreters will then be ready to assist if you would like to share something later in the meeting. Okay. We're going to officially start now, and I will introduce myself. I'm Barbara Neal. I'm Executive Director of the Vermont Enhanced 911 Board and co-chair of this task force, along with Commissioner Jennifer Morrison from the Department of Public Safety. Also with us today from the task force is Paul White, who is the vice chair of this task force, also the former chair of the Berrytown Select Board, and the chair of a regional dispatch working group that tackled this very subject a couple years ago. Thanks for being here, Paul. And also from the task force is Michael Wright, who is the CEO of Calex Ambulance and is representing the EMS community on the task force. We very much appreciate everyone taking the time to be here this morning. We're looking forward to your views on emergency communications in Vermont today and how we can all work together to develop plans for the future. So a quick agenda review. We are going to take care of a few housekeeping items and introductions in just a moment. I will give you a very brief overview of the task force work to date and what we have been tasked with. Then we'll move into the important part of the meeting, which is the community discussion, and we'll end things later on with a summary of what's been discussed. So you can go to the next slide, Bonnie. All right, housekeeping. This meeting is being recorded so that everyone is aware. We are using live polling during this meeting, and our facilitators from Mission Critical Partners will let you know how to participate in the live polling when we get to that point in the meeting. It is helpful when you're asking questions or commenting if you could state your name for everyone. And also, in case you weren't with us at the very top of the meeting here, we do have 2 ASL, American Sign Language interpreters with us. And it is helpful for all if we all speak slowly, clearly, and using plain language as we go about the meeting. So there we go. Good for housekeeping. Bonnie, we can move on to the overview. So the Public Safety Communications Task Force was created in 2023 by Act 78 and was tasked with the planning and implementation of a reliable, secure, and interoperable statewide public safety communications system. So to that end, the task force has been meeting on a regular basis since June of 2023. We have hired our project management and system planning consultants, who I'll introduce in a moment. That was done earlier this year. And with their help, the task force has established regular stakeholder updates. We are in the thick of things with data collection and stakeholder engagement plans. And as we get started, there's a couple things that I'd like to stress. The task force appreciates and values all of your input and feedback. We look forward to hearing what is and perhaps what is not working for you now and what you think could be improved upon. And also, I want to stress that the task force has no preconceived notion of the future structure of a statewide communication system in Vermont. So this community's input is essential to determining what that will look like and how it will be managed and governed. All right, moving on. I've introduced you to a few of the task force members already. Also on the task force, but not here in the meeting with us today, is our public safety answering point, and you will hear me refer to that as a PSAP. Public Safety Answering Point representative is Jim Mack from the Shelburne Police Department. The municipal representative appointed by the Vermont League of Cities and Towns is Mayor Mike Dungis from the city of Rutland. And the Vermont State Firefighters representative is Ron Kumitz, the chief of the Alberg Fire Department. And moving to our project vendor introductions. So Televate is represented today by Rick Burke and Dom Arcuri. They are the project management team for the task force. And we also have with us several representatives from Mission Critical Partners, who is our system planning vendor. First up for Mission Critical is Jason Malloy, the project manager. We also have Bonnie Maney, the operations senior advisor, and she will also be the facilitator for most of this meeting. I believe we have Scott Neal, the wireless senior advisor, and Gigi Smith, operations subject matter expert. Did I miss anyone, Bonnie, from Mission Critical? Okay, all right, good enough. So thank you to everyone from Televate and Mission Critical for being here. We will hear more from them as we go through the meeting. And we will start with just a quick overview so that everybody's on the same page about the current emergency communication systems in Vermont. So Vermont has a single statewide 911 system that routes 911 calls and text messages to one of 6 public safety answering points around the state. All Vermont 911 call takers are fully trained and certified, including in emergency medical dispatch. So the 911 call takers answer the 911 call, determine the location and nature of the event, connect the 911 caller to the appropriate dispatch center for the needed responders, and provide any needed pre-arrival instructions to the caller while responders are en route. And all aspects of that system, the 911 system, are governed by the Enhanced 911 Board. Now, in some cases, the PSAP that answers the 911 call also provides dispatch services for the needed responders. And in other cases, those 911 calls need to be transferred to one of many dispatch centers providing service to Vermont response agencies. So in addition to the 6 public safety answering points, there are 37 dispatch centers serving Vermont. The emergency communications professionals at these centers focus on coordinating and supporting emergency responders during events and monitoring responder locations and activities. And dispatch services at those 37 centers are governed at the local, regional, or state level. And if you move to the next slide, Bonnie, we will see a map of the locations of those 6 PSAPs, the public safety answering points. Those are the icons with the little red circle around the green dot. And then we have multiple dispatch centers in Vermont and a few outside of Vermont. Those are the green dots that provide dispatch services to Vermont responders. So we thought this slide might be helpful and for you to get a picture of where all this activity in emergency communications is happening in Vermont and for Vermont. So with that, Bonnie, I will hand it over to you to take us through the next part of the meeting.
Wonderful. Thank you very much, Barb. Hello, everybody. So glad you here. The next portion of this really revolves around you and your feedback. Really is the essence of why we are bringing you together today, as Barb said, to get that feedback. So it's really all about community discussion. We are in that remote environment, and we know that at times it can be challenging to be distracted. We like to have the convenience of remote, be able to make sure we have really inclusive, participatory environment. But please try to be present. We do want you as well to be candid, yet respectful. Us as MCP, Televate, and of course the task force, we need to have honest feedback, and we want to have a positive dialogue today. Listen as
Bonnie,
partners. Yes.
we have one individual reporting that the slides are not showing. Can you unshare and reshare your screen, please?
Certainly, we can do that. Stop sharing. And then let me.
Is anybody else not seeing them?
I'm getting them.
I'm getting them too.
Okay. Well, we'll just give it a little re-push. I'm not sure if maybe they have something covering their screen, perhaps.
All set.
Okay.
They're all set.
All right. So, so listen, not just as partners, but listen as neighbors, as community members. Yeah, we do want, again, we want to, make sure that we're candid. If you're going to, in criticism is fine. Let's make sure that we do that with ideas, and let's think big picture. When we say that, like I said, we not only are we thinking about, how maybe your experience have been individually, but again, thinking as a community, as a region. And then if there are some thoughts that kind of aren't on topic for what we're talking about, we do have something we call a parking lot. Jason is going to be monitoring the chat. He's going to be monitoring the lobby, and he's also going to be making sure that we jot down any notes and things that maybe we put aside for a later discussion. Right. So with that, as we mentioned, we are going to be doing some live polling so that, again, between the chat, being able to raise your hand and speak, we want to make sure, again, that we provide so many different ways and opportunities for you to share your input. So one of the ones we're going to do is with polling. And you can put your response to this in the chat. You can raise your hand and let us know your response. But one thing we want to know is, what's one key takeaway you want us to gain from today's listening session? And now, how are you going to provide that information? And that is here. If you have your phone, you can take a picture of that QR code there in the upper right-hand corner, or you can use text on your phone, and you can text the BMANEY 119 to that message number there, 37607. Once you access that, the chat will, your text window will stay connected, and you will just get the next poll, and the next poll, it'll automatically switch. So you don't need to, text that each time. So you can scan the QR code, you can join by text. You can also join on your computer by entering that web address, pollev.com/bmaney119. So that's POLLEV.com/BMANEY119. And once you get to there, again, you should have the interactive window. So as you all get on there, if you want to, you can also, again, like I said, you can put it in chat, or you can raise your hand. We'll start seeing the results pop up here right on the screen, and nobody has responded yet, but we'll set it on here. And Jason, do we have anybody in the chat or anybody raising their hand to share their thoughts of one key takeaway that they want us to gain from today's listening session?
Bonnie, Jonathan Hines advised he needs to discuss some issues that he has had.
Okay, and we're going to get to that of sharing of thoughts. Are you talking about? He's muted. Can you unmute, Jonathan? No, you cannot. Okay, let's see. Can you
Jonathan, if you type in chat, I can relay the message to Bonnie.
So he's having technical difficulties, is what I'm gathering. Jason, while you monitor that with Jonathan, we do have a couple of responses. So we need better systems set in place with police or the right departments to deal with safety problems. And if there, let's get that back. And then the other one, if there is a central source to read about emergency communications. All right. So one thing we want to focus on today, and we appreciate that feedback. Let's see, I'm interested in alerting residents to various pending disasters, allowing individuals to say if there is need for special help. We have a specific, I like to thank you for putting the region in here for Champlain Islands, not well served for person-to-person radio communications. All right. And then, of course, yes, AI technology and advantages and disadvantages, updating and upgrading the systems. There's a lot of information. And as we did say, we are capturing all of this for later as well. Micro rural Essex County, Vermont. Very interesting when you say micro rural. We are seeing some of that. Some of these areas are small regions. So thank you for providing that information. What we do ask in this here today is we are focusing on the receipt of calls that need to be, for service, and that initial dispatch. We do not want to focus today on the actual response of public safety field responders. So not that it's not important. It is very, very important. But today's conversation is about the communications piece, not about how quickly perhaps or how you were treated when the fire department arrived or something like that. So just to be clear with that, and I am seeing this in the chat or in the responses. Let me get this over here so I can do a little scrolling. Micro Essex, remote geography, lack of cell service. We've heard that a lot about the lack of cell service. Appreciate you sharing that. Trying to put together an ambulance crew. Won't work if we can't hear each other. That is very true. A lot of times, whether that be from radio communications, cell communications, or even sometimes if it's when you have to relay information by phone, all of that can definitely impact that. And then about the special alerts as well. I understand you guys have had some terrible river flooding up there last year and this year. So being able to have emergency alerts as well. All right, we're going to move forward on that. Thank you again. Jason, is there anything else in chat or anybody has their hands raised? Have we solved Jonathan's problem?
He's advising he would like someone to call him at a specific phone number. Jonathan, we can provide that and arrange a phone call after the meeting.
He should be able to call into this Teams meeting.
That is an option. Great idea.
If he can't unmute his computer, maybe he can call in on the phone.
Right, Jonathan.
I'll provide that in the chat. And while I'm doing that, Jane English has her hand raised.
Okay, Jane, go ahead. Oh, Jane, are you there? Can you? Jane, you can go ahead and speak if you'd like. 'Cause- 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 You are unmuted. Why can we not hear you? Others have been able to unmute and we can hear them. Jane, if you would like to put your comment in the chat. All right, we'll wait for Jane's response as well. Let's move on here. So
Okay.
you're
I have
going.
her response, Bunny.
Okay, go ahead.
Her response is, we on the town's emergency management committee here in Calais want to know how our internal emergency communications via GMRS and ham radio can interface with state systems. She is a RACES member and has done emergency communications with the state in the past.
All right. Thank you very much, Jane, for sharing that. Definitely something that we're glad that you want us to take away from today and that information. So we'll be able to note that down as well. All right. So this the conversation today is going to be broken down into two types of segments. First is about the current state.
Hello?
Yes.
Yes, it
Hello?
is.
Yes, we can hear you.
Hold on a second, please. Hold on a second.
Okay, I think Jane was taking a phone call. So it's going to be broken down into two aspects. First, couple of questions are going to be about the current system today, the current emergency communication system. And you heard Barb mention this. What is working well today, and maybe what is not working so well today? I don't know who on the call maybe has had a personal experience or need to call for emergency services. We definitely want to, you to take that into consideration. Yes, Jonathan, you have had that. Is okay. Jonathan, try to use your telephone to call in on the number. Is there somebody perhaps on the task force that can help Jonathan on the side? I want to make sure he is addressed, but I also want to make sure that we can keep this moving forward. And perhaps it is having a separate conversation with Jonathan as well to get his perspective separately.
I can take care of that.
Thank you.
Thank you, Paul.
Appreciate that. Again, so what's working well, what maybe not working so well based on your personal experiences with the current system. And then after these couple of questions, we're going to actually talk about the future state. What do you think maybe could be improved upon? All right, so let's go to the next slide. It is another poll. Again, you can answer in poll, you can answer in chat, you can raise your hand. What is working well today with the current communication system? What do you like about how your 911 and dispatch system is doing today? Any thoughts there? Fast responding. And if you wouldn't mind with that too, what area are you in when you say that? I mean, it is a pretty big state, about 600,000 residents. So fast responding is good to know. Any other thoughts? What do you like about the system today and how it works? You have a lot of people in the chat, and I remind you, we really want to hear from you. So please do not be shy. Please put things either in the chat, raise your hand, or on the poll. Or is it just the fact that there doesn't seem to be a lot that is working well today? Some of the dispatchers really get drumbeat of how calls unfold in Grand Isle County. Okay. Whoever that is, would you mind unmuting and sharing a little bit about what that means? So we don't, we want to make sure we have context there. What do you mean by drumbeat?
Hi, this is Bob Melcher from South Hero Rescue.
Hi,
I used to
Bob.
work for a phone company in Lancaster, Pennsylvania, and we ran the Lancaster County 911 system. But I was only involved in circuits. But the Lancaster City Police Department always wanted their own dispatch because things would be happening in the city that somebody 30 miles away in Mannheim wouldn't understand.
Mm.
Our dispatch is Shelburne.
Mhm.
And when we get one of the regular dispatchers, and there seems to be an unfortunate high level of turnover, but when we get one of the regular dispatchers, they understand where we are, what we're doing, what we're likely to need. And it is really, really helpful because we're a bunch of volunteers and we get calls like 17-month-old not breathing.
Mm-hmm.
So that the communication attaches to humans at both end, to me, is the
Right.
focus.
Okay. So you're the value of having that local dispatch center and their local knowledge, if I'm understanding what you're saying.
Yeah, just so long as they understand,
Yep.
as they understand us and take a lot of calls from our town.
Okay. Got you. All right. Thank you for that. Any other responses? Any other things in chat that you think is working well today? 6th County, very low population area, mostly volunteers again. Sounds a little bit like Bob Melcher as well. Very fortunate to have an amount of volunteer first responders to respond. Okay. With poor reception. So with that, whoever's there here from Essex County, is it a similar situation for you that Bob was just relaying about local knowledge? What is it about the dispatch side? Is it that they have more resources to be able to dispatch because you have so many volunteers? Is that person from Essex trying to speak?
So Bonnie, Sharon Ellingwood in the chat says yes. Colebrook Dispatch covers Canada, U.S., Maine, New Hampshire, and Vermont, over 1,400 square miles.
Wow. Okay. All right. Thank you for that. So let's see what we have here. That's an enormous ask with low population to find responders. Yes, it is. It very much is. Let's switch gears to what is not working so well. And I will throw this up there again from another poll perspective. What is not working well today? From your personal experience, aging Vermont systems and infrastructure statewide. Again, I'll ask with that, whoever posted that, if you wouldn't mind coming off of mute and sharing a little bit more about your experience, specifically if there's a specific system that you're concerned about, or more than one system. Whoever posted that, yes.
Matthew has his hand up.
Yes, this is Nancy. I did post that. I work within Vermont on 12 subcommittees. So yes, every single one of them is aging, and it's a hindrance at this point.
Okay.
It doesn't matter what we're in. Yeah, but the answer to your question is Vermont's, systems and infrastructure goes hand in hand. And I'm not just in the medical, I'm in education, legislative. I can go on and on. I can tell you this, it's, it's one hand in hand. It's just, the system of Vermont is just not up to date, and it's being worse for others, in harm's way. It just needs to
Gotcha.
be updated. And thank you very much.
Thank you, Matthew. Nice to see you again. Okay.
And Bonnie, along those same lines, Sharon Ellingwood also shared there's something called Line A, which is Canadian border interference with the border for communications and radio service. She said that is a known issue.
Okay. Right. Thank you for that, Sharon. So we also have another response in the poll on the screen. A few years ago, we had an emergency during which residents were told not to drink tap water. Lots of people never heard about it, or if they did, it was a neighbor running around knocking on doors, not good. So this sounds a little bit of a reference back to emergency alerting systems, which, understandably, a lot of times, when we first have an emergency or a disaster of some sort, that information, 911, is the first in your local, law enforcement, fire, and EMS. They're the first to hear about it. So being able to coordinate that, whether that be locally or asking for outside resources. We have just responder to responder radio as something that is not working well. And then also for Addison County, several areas with poor or no cell service, so no possibility of contacting 911, especially when you're mobile, by the sounds of it. Okay. Anything else? Anybody else like to share what they think is not working well? All right. Well, this is not the end of a conversation on this part of it. If you do think of something, please don't hesitate to put it in again into chat or something like that. Raise your hand. And at the very end of this presentation, as well, of this listening session, there is some contact information to be able to share your ideas if something comes to mind later on. Well, let's switch from current state to future state. So, public safety communications, or public safety, is a very personal part of our worlds, and we always want to make sure that we are feeling comfortable and confident that we can access and receive emergency services if we ever need them. And so this is where a lot of this work for Televate and Mission Critical Partners and working with the task force is to really now get a sense of what is your vision, what are your visions for the future of a statewide emergency communication system. And we're going to have to talk about three things in this part. What expectations do you have for emergency communications in your community? And so it's going to kind of, we're going to bring it back. We're going to take it from state down to community. What is something you would not want to change? If there are changes, what is something that you were really thinking, we don't want this to change in our community? And then how do you think the emergency communication system could be improved? Now, the first two of those involve, again, a poll option. The third one, though, hopefully you guys will be really warmed up by then, and we really want to engage coming off of mute, sharing in the chat, and that is going to be more of a conversational question. So first up, so you guys, like I said, you're warmed up now in how this is working, but what expectations do you have for emergency communications in your community? I know we heard from Bob, the fact that, wherever the calls are being handled, that they take enough calls that they know the community. And, what else is there for each of you that is very important to you? What are your expectations when you need to call or contact emergency services?
Bonnie in chat, Jane English, would like to know what preparations Vermont has made or looked at in regards to coronal mass ejections, the CMEs coming from the sun that can take down all kinds of electronics.
Somebody from the state or Dom or Rick want to see if they can at least give Jane a little bit of information on that?
I'll chime in just to say it is not something I'm familiar with. I'm wondering, Rick or Dom, do you have any information about this topic?
So this is Rick Burke of Televate, and let me put my camera on. So the good news is that these events rarely happen, and when they do happen, the architecture of the radio networks, of the communication networks, are secure enough and solid enough that we don't anticipate and we don't experience these types of issues during public safety communications. The way the networks, the public safety networks are built, they're built to accommodate and to resist these types of incursions. However, if they do happen, we have backup networks, and we always can rely on a backup network in the event that we do have a disruption of this magnitude.
Jane, hopefully that answers your question for right now. If not, let us know. Okay, thanks. You're welcome. So one community expectation we have just posted on the screen that it's accessible 24/7 regardless of the access method. That would require solid cell service. All right. And then in Grand Isle County, fast responding to calls is a high priority. In Grand Isle, do you know what kind of how long it takes right now, kind of an average response time? Trying to get kind of a definition around or an understanding and context. How do you define fast responding? Right. So while if somebody can respond to that about, whoops. This comes back up. So for Grand Isle, right? If whoever posted that could let me know how do you define fast responding? Expect that my dispatch area has the radio and tower coverage to reach first responders out in the field, even in Essex, even in the remote areas of the UTG and forests, especially on remote trails for snowmobile accidents, hunting, domestic situations, etc. All right, appreciate that.
Bonnie, Matt has his hand up.
Yes, Matt.
Yes, that was my question. And yes, it takes about, and fast response should be immediate. Out here, you don't get that. Every municipal is different, and we've seen that across the state. You got volunteers that, like I said, can do the job. It's just, when you got literally limited, like police service, you only got one out here. And there's, like I said, and all it's our mutual aid pretty much. But to me, it's like fast response should be anywhere between, as the call should be live, actually, should be anywhere between 10 to 15 minutes per that call. Out here, we're seeing at least between 15 to 30 minutes out here for the call, because due to, we're volunteer, most of us are volunteers, and it ain't just firefighters and EMS, it's police too as well. And per, municipal district, not every police, like, every town has like 3 or 4 police stations.
Right.
Out here, we only have the one that represent all of us is Grand Isle County Sheriff. So it's that should need to be addressed too as well. It's the call response time too as well.
Okay.
Thank you.
Yep. Now we do know, I know one thing that the state has done is with what they call the emergency medical dispatch. That does allow call takers in the PSAPs, the 911 centers, to provide pre-arrival instructions for accidents, bleeding, trauma, things like that, when something is a medical in nature, which does help in between the time that the call is received and actual medical professionals could get on scene, which is a really nice thing to have. A lot of states don't have that statewide. But at the same time, we understand as well that when calls are being transferred, that can also take, it adds additional time to calls and trying to find those volunteer resources. So thank you for that, Matthew. Any other, let's see, do we have any other responses in here? Comprehensive coverage. iPhones can make satellite calls now. Okay. Yep. Let's see. Resources for people trying to prevent or ease emergency situations is an expectation. Again, if whoever answered that, if we could add a little context behind that, if you wouldn't mind coming off of mute, what do you mean for people trying to prevent or ease emergency situations? Are you referring to what I just kind of mentioned, the pre-arrival or instructions over the phone? So a little bit more context if somebody wants to come off of mute for that. Oh, I did it again. I keep scrolling on my mouse instead of scrolling on the side, so I apologize for that. Here we come. It's going to refresh.
And Bonnie, if we get an answer to that, then Barb also had her hand up for a moment.
Okay. Barb, go.
I just wanted to add a little bit more on the topic of pre-arrival instructions. So you're right, Bonnie. All 911 call takers in Vermont are certified in emergency medical dispatch, or EMD, and they do provide those medical instructions. They are also required to provide pre-arrival instructions for law enforcement situations and fire events. And the point of the pre-arrival instructions, which by the way are all scripted, there's all protocols for many different kinds of events that can happen. So the scripted instructions are there and are designed to hopefully keep the situation from getting worse before responders arrive. And they're geared towards, well, certainly in a medical situation, towards patient safety and care, but also caller safety and bystander safety to these events. So just a little bit more on the protocol process in Vermont 911.
Great. Thank you, Barb, for reminding me about the fire and the police protocols as well. And I would highlight that even as I mentioned, having the emergency medical dispatch statewide, not all states have that. And it's even more rare that the emergency fire and emergency police dispatch pre-arrival instructions and protocols are used statewide. So that's definitely a very positive, part of the emergency communication system in the state. Any other thoughts as far as expectations you have for your community when it comes to public safety communications? Nobody wants to expand on the answers or resources for people trying to prevent or ease emergency situations? Oh,
Bonnie, Megan in the chat said, having resources for people in domestic violence or stalking situations and trying to figure out what they can do if an emergency situation occurs. She lives in Bradford, and the police department doesn't answer the phone and were unable to help with questions when it came to easing a stalking situation.
Oh, okay. Megan, I'm sorry you had to go through that. Thank you for sharing your concern and your information there. So, definitely making sure that resources and information is available is very important to our communities for sure.
And Bonnie, to go back to the beginning, Paul has now completed his phone call and has Jonathan's information and can share it whenever.
Absolutely, Paul. Let's go right ahead.
Okay, so Jonathan, it's actually, he had a medical event. This is actually 2 years ago, but I'm not sure that anything has changed since then. He lives in Braintree, Vermont, which is pretty much dead center of the state and very rural. He had a medical emergency and he tried calling 911 from a cell phone and nobody answered. And after a period of time, he says he got I've not heard this before, but he got a phone call back from a Massachusetts number with a recorded message saying, "You are outside of our service area. We're not able to help you." I'm not sure if that was from a first responder agency or from a phone company or who it was from, but in the meantime, someone was able to get to a landline phone, call for help. He ended up going to the hospital by private vehicle, but his problem is that he was unable to reach anyone by calling 911 on his cell phone. He since then has tried to get permission. He called the state police and asked if can I place a test call to 911 just to make sure that it's going to work next time I need it, and was told no, you're not allowed to do that. And so he's concerned that if he ever has another need to call 911 on his cell phone, he has low expectation that it's going to be successful.
Okay. Paul, first of all, thank you for helping with that with Jonathan, and Jonathan, thank you for being persistent and letting us get to you and so you could share your story. Barb, yes.
A couple things. First, I just wanted to let Jonathan know that if he would like to arrange a 911 test call, he can call our office and we will make that arrangement. The number is 802-828-4911. And we'll get that arranged. I can't really speak to the incident that happened a couple of years ago because there may be many factors involved. The circumstances aren't something that that I'm familiar with or have heard of. So there must be some very specific things that happened that time. But generally speaking, if there is ever an issue getting through to 911, you can call that number again right after it happens, and we may be able to investigate what happened, whether the call never got through the originating carrier, through the telephone company to us, or where any breakdowns occurred. So anyway, I just wanted to put that out there, that if there are ever any concerns about a 911 call, call our office, or you can contact me by email, and we will do our best to get to the bottom of it.
Okay. And thank you, Barb, for letting him know that to get a hold of your office to arrange that that test call.
Yes,
sure.
Absolutely.
Okay.
And we have two more in chat. One of them, Barb, I believe this is going to be a question for you. Is there a contingency plan for maintaining or redirecting 911 and dispatch communications during a disaster event when cellular, landline, and power grid and internet are down, similar to what occurred in Washington County during the 22 winter storm?
So within the 911 system itself, so I'm talking about those 6 public safety answering points. If there is a failure within that system, say one of the PSAPs goes down or is not available to take a 911 call for any number of reasons, the 911 calls will automatically and seamlessly reroute to an available call taker in one of the other 5 centers. There are various levels of failover and redundancy within the 911 system to ensure that calls get to a 911 call taker one way or the other. As far as the power concern, certainly our PSAPs and our system are backed up, if you will, by generator power and that type of thing. Addressing the harder issue is the events where cellular, landline, and VoIP telephone service itself is down. And so it can be helpful to have various mechanisms to reach 911 in those events. But that is a trickier problem. As for the dispatch communications, that will likely failover and redundancy within the dispatch centers, those 37 centers. will vary by agency. It is something that this task force is actually looking at, right? What mechanisms are in place for backup and failover and contingency planning. So I hope that addresses the question at least to some extent.
Thanks, Barb, and thanks for the question, Nick. Bob Melcher noted, I know seeing this in chat, dialing 611 on your mobile phone and ask the phone company that lost a 911 call why that happened. Generally, they take those things very seriously, Bob says. I guess that's another avenue to Jonathan to inquire. All right. Thank you guys for, warming up a little bit and sharing a little bit more information. Really appreciate that. Let's see, what do we have next is the next question. What is something you would not want to change? So as, we're, trying to make recommendations to the state, and the state's considering, and the task force and such is considering those recommendations. Are there things that you would absolutely not want to see change when it comes to your public safety communications? So it takes a minute for folks. Anything you would like not to change? Or are you open to anything that can make the system better? Some questions, I know, Bob, you mentioned about having not necessarily local call takers, local dispatchers, but at least that those that were taking the calls would know about the geography, know about the local information about where they're dispatching for. So, is it important to have an actual physical call taker or dispatcher in your community, as long as they know about your community? I guess that's my question, Bob, if you have something to share on that. People who understand the local situation is coming in on the poll. Keep dispatch local.
Bonnie.
Yes.
Sorry, Bonnie. Also, Matt does have his hand up when there's an opportunity.
Yep. Give me 1 second, Matt. People who understand the local situation, that kind of speaks to does speak exactly to what I was just mentioning. Keep it local. Ours is out of state, but it's critical knowledge. So with that comment, it's out of state, but you want to keep it local. So is it still local because you're so close to the center, even though it's out of state? Just want to kind of get, again, a little bit more context there. Whoever did that one. Would not like to see consolidation to the point of losing local knowledge. Okay. All right. Totally understand that. Yes, out of state dispatch is 2 miles. Okay, so it is, even though it's out of state, you're on the border, it's very, very close. Okay, I got that. Awesome. Matt, go ahead.
Yes, digital assets. For the state 911 system, most everything is digitized. Even their 911 systems and files, and dispatching, data. It's one thing that we do not want to lose is that digital fingerprint, as like most police station fingerprint you, but the saying there's also digital fingerprint within Vermont's 911, trail, so we can go back to that if there's any problems. So that digital asset or digital fingerprint of the system, to come back to if we have any other questions, so we don't lose that, collaboration. So we do not want to lose the collaboration effort, as emergency dispatch altogether. So thank you.
Right. And that actually, Matthew, that speaks a bit to, quite well to, Jonathan's, challenge and, kind of trying to figure out back then what had happened. So that is very important when you do have a lot of, Barbara said, 37 dispatch centers. There's a lot of could be a lot of transfer points to try to keep the flow of the call and what happened at each point should something unfortunate occur. So thank you for that. Any other thoughts? Again, there are several of you on this call. There's 15 or so that are not including, myself and Jason and the task force members and Televate. So, but there's, still about 15 of you all. Any other thoughts? Something you don't want to have change? Okay. Seems that most of it is focused around local knowledge from those that did respond. Now, before I move on to our last question, which is the conversational question. So this is going to be a little trickier because I am going to try and go around the room and make
Bonnie,
sure
we do
that...
have one that just came in on
Oh,
chat.
yes, please. Go ahead.
Bob Melcher said he's met one of the dispatchers once, but still, because most of our calls go through the same people, local knowledge and a radio relationship are critical. They don't have to be local.
Okay. Thank you, Bob. Appreciate that. So, so the last question, and like I said, this is going to be a little trickier because I want to go around the room to each person, and hopefully, if you can unmute and share your thought, that would be great. If you could put it in the chat when we call upon you. If you can't unmute, that's okay as well. But want to make sure that, again, everybody has had an opportunity to speak. How do you think the emergency communication system could be improved is going to be the question. Before I get to that, so y'all can think about it a little bit, is there anything, Barb, Paul, Michael, Dom, Rick, Jason, from our team here that, anything based on the conversation and what we've heard so far that you would want to share or ask back? Yes, Barb.
Oops, sorry, I was muted. I just posted in the chat 3 links that might be useful to some of the issues that have been mentioned today. One is a link to VT Alert, which is a program managed by Vermont Emergency Management that allows Vermonters to sign up for public notifications of issues and events. So that might be one tool as far as getting people notified in the event of certain emergencies. Then also there's a link to the CARE program, that's Citizens Assistance Registry for Emergencies. That is a partnership between 911, Vermont Emergency Management, and the United Ways of Vermont that allows individuals with specific needs to register with the program. Responders can access that information during widespread events like flooding or storms that are leading to evacuations or isolations, so that people with extra needs, perhaps functional needs, can get the assistance that they need. So that's the CARE program. And then there is another program called Supplemental Alley, which allows you to attach information to your phone number that you would want a 911 call taker and then a responder to know about should you need to place a call to 911. So those links are in the chat if people find them useful. Thanks.
Thank you, Barb.
And we do have one in the chat so far, Bonnie.
Okay, go ahead.
So Jane English says most of the discussion so far seems to focus on specific localized incidents. The Calais Emergency Management Committee is looking at things like larger situations, floods, blizzards, hurricanes. So specifically, they're looking how to improve town-to-town communications, local EOC to local shelter communications, road crew communications, etc.
Jane, that's a really important element, I think, when it comes to communications, right? We think about it from the 911 to dispatch to the initial field responders. But when we look at larger incidents like that, there's a lot of communication that happens over radios and cell phones that need to be timely. When it comes to engaging other emergency responders, or not emergency responders, sorry, what we would call mutual aid, whether that be public works, road crews, shelters, those things that you mentioned in your chat. So really appreciate understanding based on the question here on the screen. That's something that you think needs to be improved upon, is the communication in those events. All right. Anybody else from the project team, from the task force? Any thoughts before I go around the room? Okay. Excuse me. Let's see. Whoever is representing together mode, no, that's somebody's mode. Never mind. That's how you're observing things. Bob Melcher, what is something you think, or how do you think the emergency communication system could be improved? If you would come off of mute and share your thought.
Just more radio towers and a comprehensive plan and training for when you're out of radio communication. Again, in Pennsylvania, the county of Lancaster, I know we don't have county, which is the size of Vermont in terms of population, provided all the radio towers, and there were no blind spots for, at least the police reported there were no blind spots. That's about it in the purview of this.
Okay. Thank you, Bob. Brent Demers, if you could come off of mute, if you wouldn't mind, and share, how do you think the emergency communication system could be improved?
Hi. I didn't realize I had my hand raised, but trying to get an understanding of what the system is exactly that we have. I've been doing a little research, looking into what some other cities have done, states, with something called New Generation 911, and if anyone could speak to that.
Barb, anything to share on Next Generation 911 in the state?
Right. So Vermont does have, well, Next Generation 911, first of all, is an evolution, right, of technology. And Vermont has been evolving since about 2007 with elements of Next Generation 911. And we started with what's called an EZNet, which is a network that allows for emergency traffic to traverse it. In the case of Vermont, it is the system that connects 911 callers to a 911 system. So that part of NG 911, Next Generation 911, is in place in Vermont and has been in place for quite a long time. And there are many other elements of next generation technology, and Vermont is at the forefront of many of those components of NG 911, and we continue to remain engaged at the national level with the standards as they're developed, and then deploy those or implement those standards here in Vermont as they come along. So a couple of examples of how NG 911 helps. Earlier I spoke of if a PSAP is unable to answer a 911 call, or all the call takers are busy on other 911 calls, the system will automatically and seamlessly route the call to one of the other 5 PSAPs. In a legacy system, those that failover and backup was much more of a manual process. This happens within the system itself. So that serves the caller better. It prevents them from sitting in a queue waiting to be answered, and gets them to a live call taker sooner. So that's one aspect. Another aspect that many people, I think, don't realize we have in Vermont is text to 911 capability. So anywhere in Vermont, you can text to 911 to get assistance. That's from any carrier. This is a tool that is helpful for situations when making a voice call to 911 might endanger the person. It's also helpful for our deaf and hard of hearing community to reach 911 directly. It is also helpful in situations where you may not have enough signal to make a 911 call, but you can get a text through. So we refer to it as call if you can, text if you can't. So a voice call is typically smoother and a little bit easier to convey information. But if you're unable to make a voice call for any reason, text to 911 is available in Vermont. So we are on it as far as next generation 911 goes, and continue to watch the industry for advancements, which we will then consider and implement as appropriate.
Thank you. May I ask one more question?
Sure.
Yeah.
Has Vermont looked into or have that I'm not aware of real-time information centers?
Real-time information centers. I'm not sure. I'm not familiar with that term.
Yeah, some other cities, larger cities, have built these systems where it's a funnel for all of the emergency situations that are happening and unfolding in the moment. And some of those are like mental health crisis, which law enforcement doesn't necessarily need to respond to, but so it's sort of this umbrella or funnel where they're determining in the moment what resources to dispatch, and it's something that a lot of other cities, I think Seattle, and some other cities in Oregon have implemented that have really been successful. There's actually a Forbes article on it. Yeah, it's just something that seems to be a lot of success in getting information where it needs to be much more quickly.
Brent, is that mostly from the articles you're reading? And I know you cited Seattle in Oregon around the mental health aspect in crisis services.
No,
no?
it's overarching. I say that I'm in Burlington,
Okay.
I'm Burlington, so yes, that is one thing. But as far as in general emergency services go, it gets more information to whoever's being dispatched.
Yeah. I've heard referred to in some cases called real-time crime centers, RTCCs. I've heard not as common the RTIC, the Real-Time Information Center, which is more of a broader umbrella, or a fusion center, same type of concept. They'll kind of go by various different names. Barb, does that more of thinking of the RTCC ring true anywhere in Vermont?
Well, there is certainly a fusion center in Vermont, but I could not speak to their operations. I wonder if maybe Paul could, and I don't mean to put him on the spot, but
Yeah, the fusion center, as I know, a fusion center is more. It's a law enforcement intelligence and information gathering center. It's not at all involved in emergency response. It gathers and catalogs and shares criminal intelligence.
Gotcha. So I think in terms of as you were speaking about this real-time information center, I had a picture in my mind of like essentially a heat map, right, of ongoing activity, maybe identified by the nature of the call as well. The 911 system in Vermont does not have that per se, though call takers throughout the state can see where other calls are happening. It's really more for situational awareness, though. It does not provide a deep dive into the type of call that's going on in each of those locations. I don't know if any of the dispatch centers around the state may have some of this technology or functionality. But I mean, it's something we could certainly have on the table for discussion as we move forward.
Mm-hmm. Thank you for your question, Brent. And one of the things that is coming out of all of these listening sessions and town halls and all the research so far that's been conducted is to create an inventory for what the communication centers, the dispatch centers, the PSAPs have currently. And that does include different software programs and things like that as well that can enhance their capabilities. So thank you for bringing that question. Don Patch. Donna, can you unmute and let us know how you think the emergency communication system could be improved?
Yes, I think one improvement that could be made that I think people have been trying to do for many years is the, be careful how I say this, but kind of the separation between a 911 center and a dispatch center. Our expectations that we put on dispatch centers has grown tremendously over the years. The more technology we have, the more expectations we put on the dispatch centers. And I'm wondering at some point if we would be better served to make that separation between the two, while at the same time identifying where people would get their dispatching from, i.e. creation of either larger or more dispatch centers.
Okay.
If that makes sense.
It does. Don, thank you very much for that. EMC Panton. EMC Panton, whoever is representing there.
Oh. Hi, this is Bob Groff from Panton. So it's a generic account.
Gotcha.
Yeah. First off, I'd like to say thank you for the others for having this talk. And also, I'd like to point out that the centers seem to be doing a really good job, and I really appreciate that. I'd like to point the camera the other direction. It's people trying to call into the centers, and it's been, I think, gone over several times about not being able to connect in because of lack of connectivity. And the text to 911 is a really good one to put out there. But in a major event, many of the towns in this area would have no contact at all. And I think something like encouraging the towns to start up a small EOC with maybe a ham radio in it, because the RACES people do a great job, but they're going to be overloaded if the major event occurs. And I don't know if they'll be able to go to every town like Waltham and Panton and Addison and the other areas and be able to cover this whole area and take care of it. So a way to encourage the towns and help out the towns, maybe start up an EOC.
All right.
Thank you.
Thank you. Thank you so much. Jane, I know you've been having, you haven't been coming off of mute. You've been putting your information in chat. If you would want to share one thing you would want to see improved, that would be great. And we'll be on the lookout for that. Jason will be watching for that. Jonathan, you as well. I know you cannot speak. If there is a way that you could put a response into chat, if not, we will follow up with you as well. I want to make sure we get your perspective. Oh, Jane, thank you. Neighboring towns working together. Appreciate that. Matthew, I know you've shared with us before. What is one thing that you think you would like to see improved in the emergency communication system?
Yes, I do think, like I said, there's new technology out there. There's AI, artificial intelligence that, that help, you can thank Vermont Electrical Co-op because they're the first in the state of Vermont to utilize this, software program to basically optimize, manage their grid, electrical grid, basically optimize it in a way where, like I said, with this, there's an opportunity for us to, to see a better outlook. Plus, the AI will be able to see the future outlook and help manage. So it ain't like one person's, doing everything. It would the technology would basically help out, what I like to see is having, AI technology in all the systems. It helps optimize the system of Vermont. Basically, it takes a lot of guesswork out of us guesstimating, and guesstimating's a dangerous, thing for Vermont. We guesstimate all the time in our surveys, and it doesn't help, help solve those problems. So AI technology, emerging technology, like Barbara put and said about having that new generation 911, but also there's a new forefront of having AI technology that could be fusioned in the system, or emerging technology to be added to the system to basically have a better outlook, but also have a better system that can be optimized in a way where it doesn't, rely on heavy bandwidth, because bandwidth for radios and stuff, it takes a lot.
Yes,
And
it does.
it just, how to make it more efficient, when we're communicating, because there's a lot of bandwidth, a lot of bandwidth between radios. Just trying to get, if everybody uses one radio band, it gets bogged down, or it gets, constricted. Whereas if you use, a multi-fractional, like a mesh radio system, you could be able to get a lot of calls out there more efficiently. The efficiency, the better for the system itself as a whole, so it doesn't break down. And that's, why we have emerging technologies to optimize that, so it doesn't, become overloaded. Thank you.
Thank you, Matthew. Appreciate that. And that is an aspect of the study, as well as looking at the radio communications piece of it. So thank you so much. And emerging technology as well. Megan, would you come off of mute and share what you think, how the communication system could be improved? Or if not off of mute, in the chat at least. No, Megan, if you are able to do that, that would be great. We'll be watching for that. Nick Emlin. See, you're already off of mute. How do you think the emergency communication system could be improved? Oh, and he went back on mute.
Hi, yeah, I had a question. I guess is wondering if the Public Safety Communications Task Force is collaborating with Vermont Emergency Management on this project. And I'm asking because VEM and FEMA are working on ways to maintain emergency communications during simultaneous outages, long-term outages of the electrical grid, the internet, and landlines. So I'm just wondering if you are working with Vermont Emergency Management on that aspect of it.
So I can speak to that a little bit. Certainly, Vermont Emergency Management is a good partner for having these conversations with. I'm not aware that that specific conversation has happened, but certainly we have an easy opportunity for that, given that they are part of the Department of Public Safety, and the commissioner of that department is a co-chair of this task force. So we will. I will have a discussion with her about where we stand exactly on that question.
Great, thank you.
And Nick, what is something that you think, how do you think the emergency communication system could be improved?
Well, I guess on that same point, it goes to what Jane was talking about. Some local communities are developing GMRS and ham radio capability, and that is wonderful because it doesn't rely on, it's independent of any external infrastructure. So to develop a way to integrate that with the with the 911 and dispatch system. I don't know if that's feasible, but that would be a goal.
Right. Thank you, Nick. Appreciate that. We have like 10 minutes left. Sharon Ellingwood, would you mind sharing your thoughts?
Hi, thanks. I'm the one from Essex County. We
Okay.
rely on an out-of-state dispatch in New Hampshire, and we do not have radio contact. We do not have sufficient radio contact in our area. It is blocked by the mountains, and we cover a very rugged, remote, forested terrain. I've spoken with our dispatch, the head of our dispatch. Our kids are in 4-H together. It's a small community on both sides of the river. The river doesn't divide us. It joins our communities, the Connecticut River. So that absolutely needs to be improved. We go from 7,000 people on both sides of that river up to 50,000 on a weekend with ATVing, snowmobiling, and recreation. And it's a very low population area to staff and fund dispatch and our first responders and our ambulance company. The other thing I'd like to see improve is communication between departments like VEM and the Department of Health. Our some things are tied to like your RPC, which ours is MVDA. Some are attached to your county, some are attached to your Vermont Department of Health district. Right now, Essex County is divided into Essex North and South, both affiliated with either the MVRH service area or the North Country Hospital area. And our medical providers are out of state in the same town our dispatch is. So communications don't always get to us.
Got you. All right. Great. Thank you so much for sharing of that. And I see Megan responded in chat. So thank you. You like the real-time crime center, you think is a great idea. And then in general, having more education, knowledge, and resources for the emergency departments for prevention and how to handle emergent situations while people wait for emergency departments to come. So thank you so much for sharing that. I would like to ask in just the last couple minutes before I'm going to turn it over back to Barb. I know, Barb, you as a task force, but I'm going to give you the last word. But our other two task force members, Paul and Michael, is there anything you would like to share from your task force perspective of what you're hearing about how to improve the system, or your own thoughts?
Well, I'll go. I guess one of the concerns that I hear a lot locally, I live in the town of Barry, and for example, I'll give two examples. There's the town of Barry and the city of Barry, and the town almost completely surrounds the city. We rely on each other very heavily for mutual aid, but yet we use two different dispatch centers and don't necessarily know what the other one is doing. Another example is right next door to me in the town of Berlin. If you have some kind of an incident in the town of Berlin and you call 911, your law enforcement is coming either from the state police or from the Berlin police, depending on whether you're on or off the interstate, and that comes from one dispatch center. If you need a fire truck, that comes from the Berlin Fire Department, which is dispatched by the city of Montpelier, and if you need an ambulance, that comes from the town of Barry, which is dispatched by Lamoille County. So you have one 911 call needing to be forwarded to 3 different dispatch centers to get first responders to the scene, which is just built-in delays. So that is something that I know locally. It's tough in that we allow the municipalities to choose who they have for a dispatch center serving them. And then that could be based on financial reasons or customer service reasons, a whole host of reasons why a community might choose one dispatch center over another. But in order for this to work on a regional basis, somehow we have to get over those hurdles.
All right. Great. Thank you, Paul. Michael?
Yeah, I'll tie on to what Paul said. I mean, I think as an EMS chief here locally in the St. Johnsbury area, and still clinically, jumping on the ambulance and QAing these calls from a management perspective, Paul's right. I mean, there's so many delays with so many different dispatch centers across the state. Using our colleagues in the Chittenden County area, it's not uncommon for one single 911 call to have to go through multiple, upwards of 5, 6, 7 dispatch centers to get the resources need for one single emergency. And I get and understand the local control and some of the benefits that come from that. However, jumping through 6 or 7 dispatch centers creates delays and problems. And again, we're fortunate in some areas. In our area here, we have a single dispatch center, but however, we're still relying on that information to come down and cross over to Vermont State Police. And again, it's not uncommon for law enforcement to be updated with information, even on medical or traumatic motor vehicle accidents, and have more up-to-date information on a response than the actual responders that need that information. So I think we need to get to a place where we have consistent, reliable, and timely dispatch across the entire system. And again, certainly echoing everybody's sentiment on cellular and radio coverage across the state. We have a lot of areas and gaps that we need coverage. I was actually earlier this morning answering a survey that FirstNet put out, and they broadcasted that network very widely. However, I haven't really seen a lot of improvements with that. One of the things that we need, again, is more towers in the areas where we have unreliable coverage. I guess that's all I got for now.
Great. Thank you. All right. And I am going to say, before I'm going to turn it over to Barb, and she'll have her closing statements, but thank you, all of you, for participating today, for sharing your thoughts. I hope you found value in, and again, inclusive, that everybody could have an opportunity. And with that, Barb, I'm going to turn it over to you for our summary and our last contact slide.
Sure. And thank you, Bonnie. I'll echo exactly what you just said of thanks to everybody that participated today. I've got notes all over the place on my papers here, but one of the things that I think I heard the most was about the need for improvements, just in communications generally, right? So access to 911 with better cellular coverage, certainly better radio coverage, as Michael just pointed out, and also more effective communications between and among the response agencies and with the public in general. So if I had to summarize what I pulled from this meeting today, that would be it. Hopefully that was one of the things that a participant hoped we'd take from this meeting. But now our vendor partners, Televate and Mission Critical, are going to take the feedback that you've provided today. We have another community listening session coming up this week. And they are going to develop reports for the task force to use to further this conversation, including with the legislature. So lots of discussion yet to be had. Thank you for being here and participating today. If you need more information, you can visit the Public Safety Communications Task Force. It is the webpage, rather. It is located on the Department of Public Safety website. If you go to that website, you will find boards and commissions listed, and dig down in there a time or two, and you will find the task force. There you will find all the information linking to our regular meetings, which are held every other Wednesday. Typically, the next meeting is on the 30th of October. And also stakeholder updates and status reports for the project. So there's lots of information there. And then you see listed here as well is the task force email address, should you ever need to reach us or want to share more information with us. So with that, nobody has anything further. I'll thank you once again for attending and hope to remain in touch as we go along in the conversation. Thank you. Hey there. I wasn't sure how many people are still in the meeting, but I took myself out too quickly. So I'm just checking back in to see if we're
Yeah.
all set. Okay.
Do we want to drop? All right, well, hold on, I can remove a couple folks. Thank you, our ASL interpreters, so much. Appreciate it. Okay, somehow I'm in together mode, which is kind of weird
Yes.
looking.
It is
Like
weird
that.
looking.
Okay, I don't even know how to get it off of here now. Let's just get rid of that. Remove that from the meeting. Maybe there we go.
There we go.
All right. I guess we lost.
I think we've lost just about everyone.
Yep, and we don't have Rick and them back. But if you wanted to debrief really quick.
Yeah. Let me see if I can reach them. Well, it's not working so well.
I thought maybe I could get them back, but they're not in my as far as
could send them a quick
participants.
email real quick.
Yeah,
Yeah,
maybe
that's what
just
I'm.
jump back in.
I'll get Paul too. There. Are we still recording?
Stop. Stop. Now we're not.